And welcome to today's COVID-19 Task Force update. Today is Monday, March 30th, 2020. And we've been doing this now for a good couple of weeks, more than 2 weeks now. I'd like to say thanks to Jean Dybo for hosting yesterday's update. And without any further ado, let's get Lloyd Phillips in here, the Commissioner of Public Safety, with today's update. Lloyd?
Thank you once again, Joe. Thank you once again, everybody, for tuning in and listening to the updates we have for the community. We have myself and Lisa Westaway here this afternoon to give some updates on what the task force has been doing, and also some of the latest developments over at Kahnawake Memorial Hospital. The task force did meet this afternoon. Good discussions, and what we're starting to do now, as I mentioned yesterday, we're looking at the long-term planning. I know people don't want to hear talking about next week, 2 weeks, 3 weeks on the road, but now we have to look at this with all our best logic and saying, let's plan for the next month. Where are we going to be in 1 month from now as a community? What are our needs? What are the human resource requirements? What are the impacts on the frontline workers? What resources are we needing in the community? Not just week to week, but now we're making sure that we're planning for a month ahead, and then as we go, reassess on how much further we need to go. It's extremely important for us to do that, because we want to ensure that we have all the proper supplies and all the proper mechanisms put together and being here in the community to support our community through this tough time. But it's also important on an individual level to plan for yourself as a household, in a month from now. How are you going to be coping with what's happening in and around the community? So, and also like even psychologically, to know yourself and say, all right, if you put it in your mind ahead of time saying, you know what, we're going to be in a situation in a month from now, it may be easier to cope with it, rather than hope and say, well, maybe next week or 2 weeks, somebody's going to tell us, okay, we could back off the measures and open up, various facilities in the community and such. That's not going to happen. So we have to start planning longer term. With that said, though, I mean, there is some good news in terms of some of the equipment we're able to get. I know there's a shortage of personal protective equipment for frontline workers. This is across North America. We managed to secure a significant shipment, which is currently on its way. We're just waiting that to get into the community sometime in the next day or two. So that's some positive news. So the hospital, fire brigade, the paramedics, the peacekeepers, whoever people working at the Elders Lodge, anybody who needs this protective equipment will have an adequate supply in the community. What I want to mention as well is the reason why we're looking longer term. Even in Quebec, they have 4 levels in terms of response into a pandemic. I know you can't read this, but this to let you know there's 4 levels, right? Green, yellow, orange, and red. And each one outlines what has to take place in terms of the response by hospitals and healthcare providers. And the first one is where we started off initially. And then that talks about the hospitals that need to be open. And for our case in Kahnawake, we always look towards the Jewish General Hospital was the first facility that would receive people from Kahnawake and around the area that would go there. But those facilities are now becoming full. So Quebec has upgraded to yellow. So basically we're in level 2 out of level of 4, which makes the area more alert and starts having other hospitals preparing themselves to receive people who have potentially COVID-19 and require hospitalization. So the second level is activated. Hospitals such as Sacré-Cœur, which is in the Longueuil area, a few hospitals in Quebec City area, Charles Lemoyne, also in the general area of Longueuil, and as well as Montreal Children's Hospital. So they are now on level 2. getting all those preparations done, because the resources at the first level are being utilized to their max. It's phase 2. With that said, we have to keep in mind the numbers are on the rise. If you've seen, the latest numbers are around 3,800 in Quebec, as we speak right now. It's a very cross section of Quebec. Highest numbers are in the area of Montreal, and Montreal is a very big region. Obviously, a lot of it has to do with density population. More people closer together, higher risk of transmitting of the virus. But also, in the area here that we live in the South Shore region, we are also up there in those numbers as well. So again, be precautious, take the precautions, and do what we got to do to ensure the safety of our community, because there is obviously that definite progression happening. Just on a few other notes before Lisa comes on, I just wanted to stress the point about measures being taken in Joe Rodo. I know a significant amount of our people have gone up north or are planning to go up north. The same measures and precautions that were taken here in Kahnawake apply up there as well. We're still asking people to social distance, or now they're saying physical distance, make it easier to people understand, to keep yourself away from other people. Not gathering in groups. Staying together is your family unit. Those things that are currently in place in Kahnawake also apply up in Joe Rodo. So I just wanted to make that clear, as well as we're keeping an eye on some of the travel restrictions. In the province of Quebec, as we know, there are certain areas that are being restricted access. Right now, there is nothing between the Joe Rodo and Kahnawake, but that could change over time. So just be mindful of that there may be some restrictions, and at some point in time, somebody may have to make a decision on whether or not you're going to stay up in Joe Rodo or come back and stay in Kahnawake. Those are some of the potential things that are coming down the road. Again, I'm not saying these things to alarm you, but these are some of the things that we're trying to be one step ahead of the game. So I think it's important to let the community know that. And certainly I was asked the questions about restrictions. Are we allowed to go from here to there? The restrictions are restrictions. It's not about politics. And saying, well, no, they can't stop us from accessing one area of the province or even in the States. Some people are asking me, well, can I go to the States still, because we're Mohawks, Haudenosaunee. We have a free right across the border. It's not about politics at this point. The virus doesn't care whether you're Mohawk or whether you're a Canadian citizen or American citizen. It's impacting us all. So these restrictions are in place for health purposes and health purposes only. It's not to do with the politics. I just want to restate that. I think that's obvious to many people. I said, but I think it's important, because we're taking our guidance based on many things that are happening in and around the province. But the province also has a large network of professionals working on this on a regular basis, and our professionals are working closely with them to give us the proper up-to-date information. So with that said, for today, I'll turn back over to Joe, and he'll take it from here. So with that, thank you very much, and I'll talk to you tomorrow. Manigawahi.
Right, nyawa Lloyd, and once again, nyawa to you good folks for watching these every day, each and every day. And so far, each and every day, we've been joined by the Executive Director of the Cattery Memorial Hospital Centre, who also happens to be the spokesperson. And we welcome her once again, the indefatigable Lisa Westaway.
That's not true, actually. I am tired. So I wanted to give you a little bit more information about the testing center today. Sometimes the things I talk about when we do the live update are as a result of questions or comments I've heard throughout the day or that have come through Facebook or through Kahnawake 911 or other means. So bear with me if you already know this information, but I think for some people it might be important to repeat it. So this is an example of the testing site. I actually don't have a picture of the traffic flow, but what we know is that we have traffic and cars that are passing through 2 security guards, 2 checkpoints, somewhere over here, driving up towards our first registration tent. So in those 2 checkpoints, you're going to be asked if you have an appointment. It's that simple. And then you're going to pass into the registration tent where you'll be registered and then asked to go into one of 2 lanes. And in one of these 2 lanes is where the nurse will come out and greet you and will do your test. We've had some issues lately right here along the front of the hospital. People either stopping their car and looking in, people walking by and looking in. So as of tomorrow, we're going to have another security guard here that ensures that people just move along nicely. It's nothing to look at. Although it's a far distance, it's uncomfortable for people who are inside the tent here being tested. So a security guard will be there. We're going to hope to put up some type of visor, I don't know, something that could block visibility into the tent, but for the time being, until we're able to organize that, we'll have a security guard just ensuring that people move through. So that's what the site looks like. So if you're curious about it, or you're uncomfortable, or you're afraid, or you don't know what to expect, that's what you can expect when you do come to the site. So up till now, we've had just under 50 people tested. I think that's interesting. What it tells us is that people are conscious, they're mindful, they're being careful about their body and what changes are happening, because we know that some of the symptoms are very mild. So it's important that we continue to be mindful of what's happening in our body if we do feel that we have a change in symptoms. Some people are taking their temperature once a day, especially if they have traveled or if they think they may have been in contact with people. That is something that you can all do. And if you do develop a fever, you can come and be tested. So we're receiving a lot of phone calls, and we're giving people appointments, and you're usually receiving an appointment on the same day. I do have one little thing to talk about regarding the testing today. I just, maybe 5 minutes ago, received a call from the lab. So once your test is done, the swab is placed in a vial. That's placed in a cooler, and 3 times a day we have transport that brings the samples to the lab at the Anna LaBerge Hospital. We got a phone call from the lab. There were 5 vials that were defective today, and therefore 5 people tomorrow will get a phone call and will ask you to come back to redo your test. The same thing is at the Anna LaBerge testing site, from what we heard, although they had a lot more cases. So we're very sorry about this. This is out of our control. It's not in the way the test was done. It's the actual vial that was used. And so you'll be asked to come back tomorrow. There are, again, 5 people, but you'll be contacted directly. We want just to reiterate for people who are non-ambulatory, they don't drive, they can't have no one to bring them in, or for people who may have physical or intellectual impairments and it's difficult to come to the drive-through testing site, we ask that you contact the phone number at the KMHC and the extension, and that you speak to one of the people who will be answering the phones, and you give them this information, and they're creating a list of these cases that require testing that cannot come into the drive-through site. So it's not we're not giving you choices. This is really in the extreme circumstance where you cannot come in. We will look at other measures to ensure that you get the testing that you require. That's it for the testing. I wanted to talk to you a little bit about Friday. Dr. Gauthier will be back Friday to answer medical questions. I just want to give a little bit of a precision regarding the type of questions that she might answer. So Dr. Gauthier is very knowledgeable about viruses. She explained her background. She will answer general questions, general widespread medical questions, but she will not be able to answer each of your individual specific questions. Why is that? It's because there are legal implications if she were to answer specific medical questions regarding your case without knowing your full medical history. So I really urge you, if you have any specific questions regarding a particular medical condition, pre-existing or otherwise, that you call KMHC and ask to speak with your physician. So our great communication guys are compiling all the questions that come into the Facebook Lives or in different websites in Kahnawake regarding general medical questions, and Dr. Gotse will be here on Friday to answer them. We're starting to have, and this is really very normal, people are starting to get a little bit tense and anxious about the self-isolation or the physical distancing measures that are being implemented. And so we're starting to get a lot of questions, something like, you know, my mother is having a birthday. Is it okay if I just go over to her house? We're starting to see that people are trying to find ways to create those social contacts or recreate or regain some of those social contacts that they had before. So we really want to reiterate, we all know, we're all going through this, how difficult the situation that we're living is right now, how much of an impact it's had on our mental well-being, our level of anxiety, our stress, our natural human need for connection. This has been really, really difficult, but we urge you to continue. So I'm just going to reiterate some of the things that we've talked about that are really, really important. Number one is that anybody who's over 70 or immunosuppressed, they should be on their own. It's not fun. It's the population and our elders and a group of people that we generally want to take care of, but we need to find other ways to take care of them. So either by leaving groceries on their front step, by, you know, seeing each other through the window, by FaceTiming, by giving them a call. And if you know an elder that happens to be all on their own, give them a call once in a while and check in on them and make sure they're okay. But we really, even if you've been in your home, we don't suggest that you go into their home because there's always a risk involved. And because we know that this population is at higher risk, we want to protect them as much as possible. Also, for those who are just coming out of their 14 days of self-isolation after travel, what does that mean? It means that you have not developed symptoms, so you did not get the virus while you were traveling, but it means that you still should maintain your home, staying home as much as possible. So remember, we often talk about staying just in your home with your direct family unit, so the people that you live with. We're not changing that approach. That approach still stands today and is really important. You may go out and do groceries. If you have to go out for essentials, of course, you need to follow all of the basic personal hygiene measures that we've asked you to implement. Hand washing, not touching your face, putting your clothes in the dryer when you walk in for 30 minutes to ensure that you kill the virus if it happens to be on your clothes. And if when you do have to go out, to maintain social distancing, or the new term is physical distancing at all times. And many of the stores that are still open, they're open because they're providing essential services. They've also implemented a lot of these measures within their environment so that you're as protected as possible. So but you still need to make sure that you're washing your hands and doing all these things that we've been asking you to do. So we know it's really difficult, and we're just not out of the woods yet. We only next week maybe will know whether we've actually had an impact on flattening the curve in Quebec in general, but we still have a ways to go before we're out of the woods and we're able to loosen up a little bit. I want to remind people that we really highly highly recommend that you stay in Kahnawake. So I don't get any details about people who come in for the tests. I don't know who came. I don't know I don't have names. I don't have any information, except I have been told that there's been a high percentage of people who are coming in for tests that are still traveling to different parts of outside of Quebec. And so I really wanted to bring it back up again, the importance of staying in Kahnawake as much as possible. So remember the most smallest unit possible, which is the people you live with in your home, as much as you can. And when you have to go out, that you're really practicing all the safety measures that we've discussed. Again, if you require assistance psychologically, anxiety, stress, there are different elements, different people or groups of people that are there for you. So there's KSCS that is there and available. There's 811. The social part of 811, they have social workers 24/7. For those who are at work, there's the employee assistance programs. And I really urge you to talk about your fears, talk about your anxieties with those who are close to you as much as possible. Sometimes just being able to be listened to is really helpful. And again, I remind you to reach out to our elders if you can as much as possible, so that they're feeling and receiving some social contact as much as we can. So that's my update for today. Thank you very much.
Yeah, well, Lisa, I have to say, when even watching these updates, you become conscious of what you do. And I had an itchy nose, and I said, well, I can do it because I had just put some of the alcohol on my fingers, so I was able to do that and come back and do it again. So you have to keep doing it, but at least I was conscious of it, whereas I know that's very difficult. People just touch your glasses, touch your nose. It happens all the time, so stay conscious of it as much as you can. Once again, with Dr. Gauthier coming in on Friday, this coming Friday, I have to tell you that there was lots of reaction from her first appearance on the update, and she will be back if you have any questions at all. And it was mentioned what kinds of questions. Send them to questions@mck.ca. They'll be gathered up and sent over there, and she'll have some time to actually come up with some of the answers to some of these questions. So we urge you to do that. Just a little shout out as well to the first responders and also to the essential services and stores that are open. So many of them have done a great job. The only store I've been in, I have to apologize to everybody else, but I've been on my way back home. Usually I can stop. If I make a stop, I've stopped twice at the Mohawk Market. And as you go in, there's Tracy saying, there's the soap. Keep your distance. And there's too many people in the store. You're not allowed in yet. They're really taking care. And apparently that's happening in most of the stores. So hats off to all of you guys, and hats off to everybody who's following the rules, because that's what's going to keep us safe. So we'd like to thank Lloyd and Lisa for the update today. We'd like to thank you for joining us, and take care of yourselves. And we'll see you tomorrow for our next COVID-19 task force update.